good.
Yep, mine is as well.
All right.
Look, and whenever y'all, all right, okay.
Good afternoon. I'm Bert Eichold, Health Officer of Mobile County, and the Health Department has issued a health officer's order dealing with food and bar establishments in Mobile County. As everyone knows, the coronavirus is COVID-19 is having a major impact around our country. Data indicates that it is increasing. So in the state of Alabama, and since March the 13th, we've gone from 1 case to now 51 cases in Alabama. We do not have any cases reported or confirmed in Mobile County. But surrounding states, Mississippi has 34, Florida 289, Tennessee 98, and Georgia 197. If we look at data, those are increased in percentage-wise. In Alabama, it's up, yesterday was 77% increase. In Mississippi, it's up 61.9%. In Florida, up 50.2%. In Tennessee, 34.25%. And in Georgia, it's up 34.93%. In Mobile, we just want to be very cautious. We need to prevent the spread of this illness from impacting our citizens. It's been described to me that this is a series of dominoes. It goes from person to person. So it's not like mosquitoes that we deal with all the time at the Mobile County Health Department and having a vector. This affects one human being to another human being. The incubation period is about 5 to 7 days. There's data to indicate that before you get sick, you may be shedding the virus. So in the sake of being cautious and trying to prevent the spread of this disease, we are issued the order. We think we will look at the data in 1 week. I'm sorry for any inconvenience to everyone involved, but the health and well-being of the community is extremely important. And this is a similar order that's been done in Jefferson County, Alabama with the Jefferson County Health Department and in multiple counties by the Alabama Department of Public Health, State Health Officer. So as we go forward, we want to be cautious. We want to look at this. We apologize for any inconvenience, but it's very, very important that we protect the lives of the persons in Alabama. Will coronavirus cause problems? The answer is yes. It's much more contagious than the average flu. The adverse impacts of this coronavirus is much more significant in the potential loss of life. We don't know good denominators, how many people. We know how many people have it. We know how many confirmed deaths that we have with it, which is running significantly higher than the average seasonal flu. So at some estimates, they said this could negatively impact human life in the United States to up to 200,000 people. One other estimate gives the data is it could go as high as 1.7 million people. We don't know. Is it going to go away when the warmer weather gets here like typical flu? We just have to wait and see. This is a novel virus that not a single person in Mobile has immunity to. There's no vaccine for this. It does have a significant mortality rate with older people, people who have chronic disease. It seems to be sparing young people and children, but it's the risk that we have to protect, and we cannot afford to let the healthcare population, the people who provide health, be overcome with patients if we're going to have better outcomes. So that's the great fear, is we can't present this. We don't have enough medical capacity to treat everyone in Mobile County potentially who can get it. So this is a great opportunity for an ounce of prevention is worth a pound of cure. If you have any questions, I will be glad to answer them.
Dr. Eichold, the mayor today said that this would not have been his choice if he was the one making the decision. Do you have a reaction to that? Obviously, you're the one who made the decision. You're the one who has that power to do this. Do you believe that you are doing the right thing, and your reaction to what he said?
Well, the mayor is a great person and a great leader of our community. we can disagree on how to handle this particular situation. I went in conference with the health officer of Jefferson County, the state health officers, physicians at the various hospitals, and at this point in time, this is the right thing to do. It's not easy to make this decision, but I think it's the right one to do right now.
Mayor Stimson said that it was your responsibility to get the testing kits here to Mobile County. What are you doing to make sure that happens?
We have put in the testing kits. The reason we are not doing more testing is we do not have personal protective equipment and we do not have the kits. Those are controlled by the federal government. Supposedly today, an airplane landed in Montgomery with personal protective equipment that is targeting going out to senior citizens, nursing homes, assisted living facilities before it's going to come to public health. We still don't have enough of the testing kits to do mass testing. It's still done on an individual basis on individuals who have symptoms. First do the flu A, flu B, strep, and if those are all negative, then do the coronavirus testing. Remember, if you turn positive for coronavirus and do not have severe respiratory distress, you're going to be told to go home and shelter in place for 2 weeks. And if you actually develop symptoms of the coronavirus, then after you've been 72 hours without fever or chills, then you can reintroduce yourself into the population.
You said that you guys don't have enough personal protective gear to do testing. As a health department, shouldn't you guys have been prepared for a possible pandemic type of situation?
Yeah, that's a good question. We have personal protective equipment for our regular day-to-day operations that we do with infectious disease. For a pandemic, we have the Strategic National Stockpile, which is a federal asset that when the President of the United States declares a state of emergency, then everybody, all states or impacted areas have access. This is an unusual because this is a pandemic and affecting all states, unlike a hurricane.
How can we be sure that there is not an outbreak here in Mobile if you're not testing?
We have to look and see. Very good question. How do we know if there's not an outbreak here in Mobile if we're not testing? We have to, if we have patients who are symptomatic, people who present with fever, chills, cough, the traditional symptoms, and don't have influenza A, don't have influenza B, then there's a high probability they could, and they're actually being tested. So people who are sick are presenting to physicians, hospitals, emergency room, and they're getting access to the very limited testing that's available. So if you're sick, have signs and symptoms, then that is being done. If for doing mass screening, I know somebody who went to China where we don't have the resources to be able to test those individuals at this time. So symptomatically, we are testing.
When are we going to have open testing here in Mobile?
I have to tell you that is a question that has to be presented to FEMA, who's in charge of the Strategic National Stockpile. We were ready to set up and do testing Monday, had we had PPE and had we had the test kits.
Gotcha.
So
Well,
it's not a lack of desire or will on the Mobile County Health Department or the Alabama Department of Public Health.
Mayor
Now, you're
Stimson
closing
seemed very
restaurants here,
displeased
but
with
there's no
closing those
cases in
restaurants
Mobile
down.
County.
Is there any way that you can assure the people here in Mobile that your office is still working with Mayor Stimson's office, even though there might have been that disagreement?
I don't think there's a disagreement. I think we had some failures in adequate communication, and we will work better with the mayor's office as we go forward, and who on the mayor's staff to better communicate. It's all in the best interest for us all to work together, and I truly support the mayor in his making Mobile better.
You said that you were supposed, from our understanding, there was an announcement from your agency that you would be at that press conference. Why were you not present when that was happening?
There was some
Why did you leave?
miscommunication. Actually, I was present at the very beginning, and then I was indicated that this was not, my services were not needed at that time, which was fine.
But since it was discussing what you had decided, why didn't you just stay?
It was, that's a very good question. I was asked by members of the team that that my services were not needed by members of the mayor's staff. And that's fine. He wanted to present his information. There was communication that was supposed to be there. We will have a 2:30 press conference. But look, it's all, we need to all get on the same sheet of music. This is about making Mobile healthier and a safer and better place for everyone.
Does that undercut what he said about this order that you put into place because you felt it was necessary?
No, I think this order is in place because it is necessary.
But what he said, how he said he wouldn't do it, does what you're saying where you think it's necessary, him saying he doesn't think it's necessary, does that undercut the person who's supposed to be dealing with the medical issues of Mobile County? Does that undercut what you believe?
No, I mean, the mayor has his opinion. The mayor's trained as an engineer. The mayor's a duly elected representative of the community, and I respect his opinion on things. But this is a health issue, and so we're dealing with it on best science that we have available in conjunction with other physicians around the state and the Alabama Department of Public Health and the Jefferson County Health Department.
Now, you're closing restaurants here, but there are no cases in Mobile County, and a lot of people are concerned that maybe you have information that's not getting released to the public
No.
because they're saying, why are restaurants being closed when we don't have a case in Mobile County?
Well, that's a very interesting case. We're not waiting to have a case in Mobile County. I have to say, this is kind of like one of the issues that you sit down and say, historically, should Lord Chamberlain have done something different during World War II that could have made things a lot better, that Winston Churchill had to take care of at a later date. So I'd rather be more proactive, prevent the spread of this illness if we can, cause a little inconvenience to individuals for a short period of time. But until we get the testing and the data, we cannot just charge forward and put people at risk.
So if someone thinks that they have the coronavirus, should they call the Mobile County Health Department since you guys don't have open testing? What
Well,
advice would you
the
give?
question is a good question. Should somebody call the Mobile County Health Department? We have a coronavirus information line, so each case is different. Where were you exposed? If you have no risk factors of exposure, then it's very unlikely, because this is a person-to-person spread of illness. And if you don't have any symptoms of fever, chills, that you're ill, then again, we have very limited testing. So look at the tip line, go online to our website, and look at what's appropriate testing. When we finally get enough supplies to test everybody in a mass testing site, we will be glad to do that and make people feel better. But again, if you don't have a risk factor, then we don't really need to do a test.
At a critical point we're in a critical point in this fight right now. How would you rate how the Mobile County Health Department and the Alabama Department of Health is handling the situation? So people at home know that do you feel confident? I mean, how would you rate you
Well,
guys?
first of all, this virus, 96% of the people who get it are going to survive. So it's been a long time since I was in school, but 96% is not a bad score. But for the 3%, 3.5% who have an adverse outcome, this is a tremendous problem. So the department's taking it very seriously. We're trying to get data. We're trying to work with our national partners. But again, this is a unique pandemic. It affects every single state in the United States territory and doesn't spare any country in the world.
So yes or no, are you guys handling it well, you
Yeah,
think?
I think we're handling it with some resources and supplies we have available from the federal strategic national stockpile. If we had more supplies, we could do more. At this point in time, the team is doing the best they can with the supplies they have. It's kind of like the Marine Corps hitting the beach. You gotta have the supplies in order to fight the battle.
When do you
Speaking
think
of
the
the
supplies will be
supplies-
here?
The supplies have landed. The first plane came from FEMA, which was personal protective equipment, landed in Montgomery. So that has to be distributed. And when are the test kits going to be available? I cannot tell you. That's a federal priority and a federal item that all we can do is keep requesting, and the requests are in to provide them. We've tried to go through the commercial side and buy them commercially from private laboratory companies, and they don't have them. So this is not a lack of political will. This is a lack of material supplies.
Kind of speaking of those tests, sorry, I've kind of got a list of questions. I keep trying to ask them, but
That's fine.
so we're hearing that some of these private facilities are testing, like Mchd, USA. They're only testing people who are who are already patients of theirs, though.
Mchd is out of testing supplies as of today, is my understanding. So they have limited number of supplies, and the number of people who actually tested Mchd was a very small number. We would like to be able to test up in Birmingham, where they had significant supplies on hand, being the facility where they were, that they acquired or whatever, like they were doing in Birmingham, but it basically shut down the interstate. We need to be discreet, and again, we want people to make sure that they're comfortable, and if you don't have a risk factor, the testing is not going to make any difference. And we don't have any antiviral drugs. We don't have anything to really treat you. It's when you have respiratory failure, then you have to go on a mechanical ventilator. And right down in Italy, that's a very scary situation, because they're actually out of ventilators in Italy, and they're making very hard decisions about literally who shall live and who shall die.
Do you see us getting to a situation like Italy currently has?
I hope not. That's why we're doing what we're doing today, is to prevent us from having a like and similar situation in Italy, completely overwhelming their entire healthcare industry, infecting their healthcare workers, and not being able to provide high quality healthcare to the people who need it.
We've seen a lot of rumors on social media, people saying, oh, there's a case at my company, or there's, this here. What would you say to the people who are just kind of seeing some of these posts and are worried?
I think everybody wants to get as much information as they can. Like everything else, is look for dependable and reliable sources. Look at the Alabama Department of Public Health website. Look at the CDC website. There's another website that I've found to be useful, which is Johns Hopkins University. So those are three real good websites regarding case information, death rates, so on and so forth. Yes, sir.
I wanted to touch for a second on the part of your order about daycares. You called the part of your order about daycares.
Oh, yeah.
You called for a shutdown of daycares with more than 12 people. Who would enforce that?
That's going to be, we have some environmental health people, but there's some dispute right now that some say that this was something that was discussed earlier, but we will respond as the community brings us to available. We're not out, hopefully, parents, but daycare children are really not the high-risk targets this. So to answer your question, who's going to enforce it? Our environmental health people will go out on a case-by-case basis to see.
I've got one question from a viewer. Were the new restrictions made in hopes of delaying potential spread until testing equipment can be arrived? And can you give a better picture of what's going on locally here in Mobile today?
The question about is the rules here. Yes, the rules here are to prevent the spread of this disease until we can get better information, more testing, and find out information. We do not want people to expose themselves unnecessarily and get sick. And then remember, this is a highly contagious disease. If anybody in this room had the flu, you'd probably give it to 1.5 persons. This particular illness, you're going to give it to 3 to 5 people because it's so highly infectious.
And about locally, maybe.
Locally, at the health department, we're still seeing patients at this location. You need to call your healthcare provider if you think you have it, and talk to them on the telephone, because we don't want people who have the coronavirus to actually go expose other people. So call on the phone to your healthcare provider. We have information available here, and we have providers answering the telephone. Yes, ma'am.
I know we don't have open testing here in Mobile County, but do you think there is someone in Mobile County right now with the coronavirus?
I would assume statistically the answer is yes. If we have 100,000 people going up and down I-10 every single day, going from Mississippi to Florida and coming in from Tennessee and actually coming in from Georgia through I-85 down through 65 to Mobile, is yes, we probably do have someone. And again, hopefully they're feeling poorly and they're self-quarantining and seeking medical help.
And also, I would think, if they're traveling I-65 or I-10, people need to be extremely vigilant at gas stations.
That's correct. Actually, it's good, the information is that the surfaces that you have, when we talk about wiping down surfaces, the virus can live for hours on the surface. So if I sneeze and cough on a countertop, and then you sit down at that table and you're going to eat, and it hadn't been properly wiped down, then you put your knives and forks down there. Is there a potential for you to get the virus or be exposed? That's why we're trying to limit this. And again, restaurants, we want people to support our restaurant industry, order takeout food, order a lot of it. If you want, buy a gift certificate and come back at a later date. There's going to be issues for that industry, and we want them to recover as quickly as we can. But they don't want their customers to get sick, and they don't want to be known as the site where the first case of coronavirus started.
Out of the hospitals that do have testing kits, you said Mosteller probably ran out. Where did they get them if we're having an issue getting them?
Well, it's not just a standard just coronavirus test kit. There's a kit that we use for the other clinical laboratories use. If you look at the kit, similar to what you use for taking for strep throat, it's a tube that has that you can go back in the back of their nose and then sample it. Then it has to be in the right culture medium and kept at the right temperature, and then taken to a certified laboratory in order to run the test. So it's not something that we can just do in the laboratory here, or the doctor can do in the laboratory in their office.
Dr. Eichold, it appears this afternoon there may have been just a little bit of a bump between you and Mayor Stimson. Do you hope to battle this hand in hand?
Oh yeah, Mayor Stimson's a good man. He's working hard to make our community better. This is a health issue. This is not a political issue. It's something that we need. If we're going to err, we need to be on the side of the health and well-being of the citizens. And I apologize for any inconvenience it has, but again, the mayor and his staff are good people. They're working hard.
Can you ask one more time, just people, about if they want to get tested, about being a patient and getting charged with their...
So if you want to be tested, contact your personal provider. And if you have symptoms, you can contact one of the federally qualified health centers as a new patient to be seen. It's going to take a period of time for you to go through, because they're going to have to establish you as a patient. It's not going to be a drive-through situation because we don't have that ability. So you're going to have to sit down, have an encounter with the doctor. The doctor's going to take a history and physical for you, then determine with that examination, do you qualify according to the CDC guidelines of who should be tested, and then test you if that is so indicated.
Okay, one more question.
Yes, sir.
So when we were at the Biobattery Medical Center,
Mosteller.
I don't know why I was forgetting the name, Mosteller, they were testing people for the strep first, the flu first. That is also going around right now. Do you have numbers on the number of people who are testing positive for flu and testing positive for strep at this point?
I personally don't have those numbers. I've been focusing my time right now on the coronavirus, but we can make those numbers available to you.
Is it tracked?
Yes, that is tracked by the Alabama Department of Public Health.
Is it going around right now? Are there
Yes,
significant cases of that as well?
Influenza A is actually, we've had 2 bumps. Usually flu runs A and B together. This year we've had a later flu season. So statistically, if you have symptoms that looks like the flu and you have not traveled to an endemic area, or you haven't had close contact with somebody who's been to an endemic area in the past 10 to 14 days, the likelihood of you having coronavirus is extremely low.
All right, thank you, Dr. Eichold.
Thank you.